not me.
Not you. We don't
Okay.
got you.
Okay. I was gonna say.
These three.
All right.
Over there.
Yeah.
And me.
I've got a 115 with somebody.
All right. We're gonna try and go live here.
This chair just got shorter than when I sat in it last. So,
Things slowing down for you at all? Or just keep?
no.
Holy cow! Ever since the restaurant announcement.
Yeah. What does it mean? How does it work?
South 40 was freaking out. I'm like, do what you can do.
I like the haircut. I was thinking I was going to have to start buying patchouli oil for your birthday.
We're live.
Okay.
You guys are live and the mics are hot.
Okay. Thank you. Alrighty. So the time is 12:01. I understand that we are streaming live. I hope we do have folks joining us. This is kind of a public health update and a little discussion of changes over the weekend. Before we begin, I'd like to invite everybody to join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Amanda, could you call the roll, please?
Commissioner Richardson?
Here.
Commissioner Thayer?
Here.
Commissioner Bennett?
Here. All righty. Thank you. Dwayne, I'll turn it over to you. It's been a busy few days.
Yes, thank you, Commissioner. Good afternoon, Commissioners, staff, Elbert County citizens. Dwayne Smith, Administrator for Elbert County Public Health. I'm here to provide the update on the COVID-19 situation and response in Elbert County. Currently, we have confirmed cases to date, a total of 54. That includes 2 cases reporting overnight. A review of the cases to date indicate a slight downward trend in the descriptive statistics for those infected. I believe the last time that I provided the update, I shared that the average age was, I want to say it was 51, and the median age was 53 and change. Currently, the average age of all folks that have been infected at some point since the inception of testing is 48.89 years, so not quite 49 years old. The median age is 50.5 years of age. We've had 25 males infected, 29 females infected. We estimate that currently there are 9 individuals currently infected, in other words, whose exposure to the virus is running its course.
The downward age trend, probably, I know we've been seeing more folks tested from households, younger folks that may be positive but not symptomatic that we weren't catching previously.
Yes, one of our cases overnight was a female in her 20s. So naturally, the more folks that get tested, the more positives we're going to find, and that figure will fluctuate over time. In my update, in my email update this morning, I shared the dashboard that has been built for us by Tri-County Health Department and their data and epidemiological staff. And one of the important metrics that we're tracking is the weekly rate of infection per 1,000 residents. Currently, the weekly rate of infection is 0.0 0.42 or 0.4196 to be exact. That is up week over week from the previous 2 weeks. However, it is still very, very low. It is lower, certainly much lower than the threshold for a lot of the action that would need to be taken. We will continue to monitor that. We appreciate Tri-County Health Department's expertise in offering this data and analysis to us. And hopefully the numbers will continue to be manageable. As a larger update from the state level, I want to remind any folks that happen to be watching, as well as folks in here, of Colorado's goals for the COVID-19 coordination and response. Our overarching goals are to slow down the virus spread so that we don't tax the healthcare safety net, so that we don't exceed hospital capacity in terms of beds for intensive care units, or also for the ventilators that are available. Statewide, the state is doing very well with regard to capacity for ICUs and ventilators. We also want to get kids back to school in the fall to as normal a school schedule, academic schedule, as can be reasonably accommodated. Most school districts are in the process of identifying what their academic year is going to look like when school resumes in August. It most likely will be a combination of in-person learning and virtual learning from home. I understand that some schools are identifying how they can maintain social distancing in the classroom. That may necessitate removal of some desks in the classroom. I would anticipate that they're probably going to be running on staggered schedules to accommodate that combined learning environment of in-person learning and virtual learning at home. We also want to prevent a second wave of infections, especially during the peak flu season that runs from November to March. We know as restrictions are eased that we're going to see an increase in the number of infections. Hopefully those spikes will be small and limited in number. So therefore, it's very important in the safer at home phase that folks continue social distancing, continue to wear face coverings when out and about, continue to ideally only go out and about for necessary activities. Obviously things like getting groceries, going to the doctor's office, but also that includes recreation so that folks can maintain their mental and spiritual wellness. We absolutely want to prevent a return or having to return to a stay-at-home phase. Again, we're in the safer-at-home phase. I anticipate, or all indications are, that we'll remain in the safer-at-home phase for many months to come. And we also want to enable local decision-making for the variety of needs that we have here in Elbert County. In a little while, I'll defer to Commissioner Richardson to provide an update on the resubmitted application for a request to CDPHE on the request for the waiver from the Safer at Home executive order and the accompanying public health order. I also want to share a couple unique things about the COVID-19 virus. It is more contagious and it is more fatal than the flu. Presentation in individuals remains unpredictable. Symptoms can range from someone having no symptoms to having very severe symptoms. The long-term consequences of infection by the virus are still unclear. Most likely will remain unclear for some time to come. In the last several weeks, there has been identification of a pediatric multi-system inflammatory syndrome, or abbreviated as Pediatric MIS, multi-system inflammatory system, that is believed to be related to a coronavirus infection. Experts are working on better understanding how that inflammatory syndrome manifests in children and why it manifests in kids and perhaps not adults. Again, there are no treatments, there are no vaccines, and just recently the Food and Drug Administration eliminated some antibody tests from the list of testing options that are available simply because they are not reliable. They are frequently invalid and really don't tell us much in terms of how we can mitigate community transmission of the disease. This virus has a long incubation period. The delay between when people are exposed, which would be day 1, and then have symptoms can be as long as day 5 or longer. In those interim 4 days, someone obviously may be spreading the disease, shedding the virus unknowingly. We refer to that as asymptomatic transmission. It's estimated that about half of the cases involve asymptomatic spread of the virus. We still don't understand if people who have had a COVID-19 infection have immunity, whether that immunity is long-lasting or whether it wanes over time. I want to remind folks that we have a partnership with Peak Vista Community Health Center in Kiowa. We encourage anyone that has symptoms of the virus to call Peak Vista and schedule a test. Also, folks that are immunocompromised, folks that are working in frontline roles, whether that's in retail or healthcare or another industry where they may be commonly or frequently exposed to folks that may be infected. We still don't have an indication of how many folks in Elbert County have been tested. We're continuing to work on that. I think it's sufficient to say we don't have enough Elbert County folks tested yet to really draw any conclusions about the percentage of county residents that have tested positive on a statistically significant basis. One, switching gears, one issue I want to speak to, as we begin easing restrictions, we are taking our guidance from the state, from the public health experts, and most recently that involved easing of restrictions, or I should say reopening of restaurants up to 50% of their capacity, not to exceed 50 patrons in any one establishment. A common question I get is, well, if I can go to a big box retailer, why can't I do ABC activity? And while the big box retailers, particularly supermarkets, are deemed or classified as essential businesses, folks need to get their food, their provisions, their medicines, other goods and sundries. That doesn't mean that is a safe venture. Certainly there are hundreds of people, if not thousands of people, that will walk into a big box retailer on any given day. As much as we still don't know about the virus, the safest thing is to limit, to the extent possible and practical, entering into those environments, understanding that we all have to get our food and provisions and things like that. So the comparison of, well, how come I can go to this large retail environment and how come we can't go to a smaller environment or smaller activity, they both carry risk. exposing yourself to the larger environment and more people that are not under your same household, under your same roof, carries much greater risk, particularly for the elderly folks. That is one of the principles that we're trying to follow when we make decisions. Some activities that we have approved, such as the high school graduations, we know that those are one-time activities. And we're trying to accommodate as normal a graduation activity as we can. Folks are aware that we also have approved churches in last week's meeting to reopen or begin again in-person worship services. We have received a variety of calls from churches, from businesses, from parents, individuals requesting everything from, can we expand the high school graduation to X number? Can we conduct a baseball tournament this weekend at a parks facility? I try to understand the request as best I can. The decision or the feedback that I am providing, I try my best to take into account the risk and benefit of each individual request. Some risks or some requests I simply don't have a comfort level with, and I share that with folks. And I don't want us to be put in the position where we're experimenting or really putting our efforts out there before it is prudent or practical, and certainly before we have some of the other safeguards in place. So I just want folks to understand my perspective, where I'm coming from. I certainly am happy to speak with anyone and entertain any requests. I do appreciate hearing perspective from folks. I try to put all of that into our conversations with county leadership and let leadership and our leadership team for the virus response know what people are thinking. I would say the overriding number of responses or comments are more or less related to the mental health and well-being, and that's a very broad bucket that I'm putting those in, but comments, people can't take this anymore. Well, that's to me an indication that they are having challenges with the restrictions, and most likely have had challenges for quite some time. This is not a normal time in any of our lives for the most part. So our response, therefore, is not going to be normal. It is going to come with an overabundance of caution. And ultimately, I take very seriously my responsibility to protect the health and wellness of the greater community. And what it comes down to a lot of times is this request that I'm hearing good for a small group, a larger size group, or is it in the best interest of the larger Elbert County citizenry? So just wanted to share that perspective for folks so that they know where we are coming from, and particularly I should speak for myself where I'm coming from. Yeah. With that, I'll be happy to entertain any questions from the commissioners.
Questions? Yeah.
I've got questions. Yeah. One is that I had a lady call me at the house last night, and she said that her mother is 88 years old, and she wants to get a test, and she has no symptoms, she said. She wanted to know if she could get a test at Peakview so that she'd find out she didn't have it before she went to see her mom. Is that possible?
While I will defer to Peakview and their testing protocols and share that currently the rule that clinics are following is if someone does not have symptoms, they're most likely not going to be tested. However, an 88-year-old is in a high-risk group. And for example, if that individual has been to church recently or another
Or went to the
grocery store, things like that, if they certainly have any underlying health conditions or what we call comorbidities, I don't, again, want to speak for Peak Vista, but I would think that person, I don't think Peak Vista would have too much of a challenge okaying a test for that. But again, completely
may wanna
defer
get-
to Peak Vista.
Get them the phone, if we
Yeah.
can get her the phone number to check, because I think your question was more about a younger daughter visiting an elderly parent.
Oh,
So
I'm sorry,
are they-
I misunderstood.
Yeah, but,
Yeah, but.
but again, I think the answer's the same. Is
Yeah.
it's-
And then my second, thanks. Then my second question is, people are talking about inside-outside use at restaurants. If they have an area outside, is that additive to the inside, or are they cumulative?
So I'll just use an example to make sure we're on the same page in my understanding of your question. If the 50% of the normal capacity of a restaurant is, let's say, 20 patrons, then the inside capacity would, or the 50% is 20, and any additional table space or patron space outside on the sidewalk or wherever, that would be in addition to. So I know the town of Elizabeth has been working with restaurants to provide accommodations to allow for expanded seating area, expanded dining space, things like that, which we wholeheartedly support. So does that answer your question adequately?
Yeah, I just wanted to make sure that when somebody asked me if they, using your example, if they could hold 20 inside, that means they could have 10 inside. But if they had that much space outside with tables, could they get back 20 or something?
Yes, and quick note on the outside space, we encourage restaurants to work with their respective fire districts. We do not want any temporary dining space created that would create any risk to fire and life safety. All requisite fire regulations and rules will need to be followed, and not wanting to speak for all the fire districts, but I believe they would be happy to consult with restaurants just to make sure everything is in proper order and doesn't create any additional risk.
Do you have anything specific?
No, I don't have any questions, but I appreciate your, the thought and everything that you're putting into this, because I know we're getting questions on different things, and, we've put in our waiver, but we can't think of everything in the waiver that people are coming up with anymore that they want to do. So I know if we're getting questions, you're probably getting 10 times as many questions, and appreciate your efforts.
Thank you, Commissioner. If I can comment on that. When executive orders are written and public health orders are written, generally speaking, they probably cover 80% or so of the scenarios that folks can envision, and it's the 20 or so % of cases that may be specific to a community or to a business that aren't clearly spelled out in black and white. And we do our best. On many occasions, I have, in conversations with folks calling in, I have directed them to the public health order or the executive order, and we read it together, and we put our heads together and say, this is what I'm interpreting. On occasion, if I've had additional questions, I refer to Bart Greer, our county attorney, for his interpretation and legal expertise. So it is a collaborative process. We certainly don't want to be heavy-handed with any interpretation. So, and we, as much as, or perhaps more than anybody, want things to get back to normal, but we know it can't be a quick turnaround. So.
No, I'd like to echo that. I mean, I know yours is a small staff, and when you when everything was closed down, that's a relatively easy process, just close down. Now the spigot's opened back up quite a bit more with restaurants. I know you talked a bit about the big box stores, but, for the last 3 weeks, most businesses other than specifically restaurants, gyms, bars, and we don't have public pools, have been operating again, and it's good to see that with that increased operation, we really haven't seen any noticeable impact over 3 weeks in any of the data locally we're looking at, which gives a lot of confidence. And I appreciate you taking calls from individuals, but for those that may be watching or others, if you have a question about can a school do something, or a comment, we would like to see a school do something, or we would like to do something in a Parks and Recs facility, or we would like to see something within a town that's different. I think for the best use of our limited staff and the most consistency, if somebody has the schools are a separate local government, the Parks and Rec is a local government of its own, our towns are their own local governments. If I would start approaching that local government that provides the service, if you'd like to see a change, let them make that first cut to decide whether that is something that makes sense or is important to that local government, and then hopefully they then bring that forward to us. I mean, I know that our public health department is to serve all the citizens, but I think that's a quicker way to get a response versus having the higher level public health review potentially on a change within a school district that the school district and the school board may not be interested in pursuing. So that's kind of a plea on behalf of our public health department to kind of start in the lower level government lane to see if it's something supportable, and then move forward. Is, like I said, very good to see that things have stayed relatively flat. I mean, throughout this last 70 plus days, a little less than 1 case a day on average. The addition of the additional, the additional data we get from Tri-County is very good. It was comforting to see that where we knew we had cases, now we know how many were hospitalized, never more than 2 at a time, and 8 over a several month period. So we certainly aren't stressing our local communities. Over the long holiday weekend, finally a response from CDPHE. They did ask for additional information, more specificity on the measures that we were proposing for specific business sectors. It's perhaps not a surprising response. It's unfortunate it took so long to get that response. So yesterday we did, in response to the request for more specificity, asked specifically for some relaxation of overall gathering sizes in the county. 10 is very small, and quite honestly, we're all aware of fairly regular meetings of people, groupings of people socially that are larger than that. So rather than turn a blind eye, it's better to acknowledge what's happening and then be able to actively support gatherings that may be looking for better ways to do it, more safe ways to do it. And I think trying to kind of bring them out of the shadows, so to say, since they're happening already. The other was a specific request for gyms and related businesses, or dance studios, gymnastics that have the space to do to safely operate at a little higher level, and modeled our request after other counties that had already been approved for such things. So hopefully we'll see some favorable response on those. And the third, very briefly, was on restaurants. We hit on 2 areas that had come up fairly regularly since the draft guidance came out. And one was our extremely small restaurants. We know we have several in the unincorporated areas and smaller towns that a 50% capacity puts them under 10 people within a restaurant, and asked for the ability locally to consult directly on site with the restaurants to design a seating arrangement that perhaps gave them some economic scale and still met all the other social distancing measures. And then the other piece under restaurants was just not really a CDBHE call, but a statement that we would consider that a liquor license that was granted within the permit, the physical space that the restaurant initially applied, if they expanded under these emergency conditions, that we'd recognize that permit in the expanded areas. Not necessarily a CDPHE call, but I think just it answered some questions that we've gotten out there. Hope to get a much quicker turnaround on this. Hopefully we will see an approval as other things crop up that we can impact. We'll continue to chip away at it. I do appreciate, again, all the effort around this table on the staff to kind of get these things going. So I know we've got another meeting coming up at 1 in a different location, but really it's a good update. We are getting more definition. It was good to see on the limited testing that we have had in the county, we're seeing a much lower percentage of positives than the state average. I think it was about 7.5% of those tested were positive locally, vice the statewide 16%. And I believe most of our testing locally is actually those that have apparent symptoms or a good reason to believe that they may have been in contact with COVID. So that would indicate to me that there's more people that feel they may have been in contact that are going to get tested, and thankfully did not contract COVID. So I think there's a lot of good news in even the small numbers that we see, and that's a good thing. So I think those were the kind of the big ones. Just before we came in, and this kind of affects the clerk as well, and I'd sent some emails around, the AG's office had reached out. They wanted to have a discussion regarding the opioid settlement and negotiations that are going on. They're available next Wednesday at 9, which is kind of our placeholder for workshops. So kind of invited them to speak to us via Zoom, and if we could get that noticed, and pretty much be the 3 commissioners. Dwayne, if you're available, and then the county attorney. Obviously there's some legal ramifications. I know we had not been one of the counties that were hit hardest with the opioid crisis, which it's hard to remember the crises that were ongoing and still ongoing in the midst of this, but I think it would be useful to get the public health vision of what we've seen in the county. Again, much more prevalent deeper into the eastern plains than locally, but I know we've been affected. So, any other? Yeah, okay. I don't think we have any other business before us. So with that, I would say it's 12:33, and we will adjourn this board. If I could get a motion.
Make a motion, we adjourn.
Second.
Say a motion and a second to adjourn. All in favor, please say aye.
Aye.
Aye. Motion carries. We are adjourned as the Board of Health. We will reconvene as the Board of County Commissioners in about 30 minutes over at the fairgrounds for land use.
Thanks for the update.
Yeah, thank you very much.